forward to going into it. It's really about leadership, innovation, systems, and responsibility ultimately when it comes to your skincare. I also want to just highlight one thing, that this masterclass is not created randomly, but it was intentionally designed in alignment with the Department of Health's monthly health awareness themes to ensure that our discussions speak directly to national priorities and real health challenges that our country is facing. Today is about SunSmart skin cancer awareness, not only as a medical issue, but as a workplace issue, a community issue, and a systems issue as well. Especially in South Africa, where high UV exposure, outdoor work, and access to care intersect. Prevention and early detection are extremely critical, and I'm sure our speaker will contest to that. Awareness is the starting point, but what truly makes a difference is how science, innovation, leadership, and even education comes together to turn awareness into action. And that brings me perfectly to our speaker today. It is my absolute pleasure to introduce Nomahlubi Nompunga. Nomahlubi is a scientist, innovator, and entrepreneur who is deeply passionate about using science for social good. She is the founder of FOI Science, a biotechnology and cosmetic science company that transforms food waste into healing biopolymers for skincare, wound care, feminine care, and sustainable consumer products, truly turning waste into wellness. Nomahlubi. Through FOI Science, she leads a powerful ecosystem that merges science, sustainability, education, and social innovation. This includes cosmetic science training platforms, an online cosmetic science school, AI-powered skin health tools, and circular economy solutions that make science accessible and impactful. Beyond innovation, Nomahlubi is deeply committed to community empowerment. She works closely with women, youth, and rural communities, equipping them with skills, tools, and pathways into entrepreneurship and sustainable livelihoods. Her work sits at the intersection of science, skin health, technology, and social impact, making her incredibly relevant to today's conversation. We are truly privileged to have you here with us today, Nomahlubi. Thank you so much for joining us. I'm going to hand over to you now, and I'll be back with everyone once you're done to continue with the next part of our program. Thank you.
Thank you, Rowen, for the very nice introduction. You make me sound like a proper person. Thank you. So I am very excited to get started today. And I feel like today's topic is very, very important to us as South Africans and Africans, especially now that the climate change is upon us. And I don't feel like we're equipped or we understand enough about the effects of climate change and the effects of the sun on our skin. So I hope I don't bore anyone today. I'm hoping you guys get excited about prevention as I am. So I'm going to start by sharing my screen and we'll jump into the first slide. Ron, can you indicate if everybody can see
Yeah, we
where we
can.
are? Thank
Perfect.
you. Okay, so like Rowan said, I'm Nomahlubi. I am a founder and scientist at Core Science. I specialize in cosmetic formulations and polymer science. So today we are going to talk about what is your skin and what does your skin do. So today we are going to start naming what actually are the skin cells and what their real jobs are. So in the upper level of your skin, you've got keratinocytes. So those, they make up the barrier of your skin. So your skin is taking up 15 to 20% of your whole body. So if you didn't have a skin, where would your organs, your lungs then go? So it is important. But also the role of keratinocytes is to protect you against water loss and then also from infections and then also with wound healing and also from the UV. Then you've got melanocytes. So melanocytes would be what slang would call black girl magic or black don't crack, but also the basis and the function of melanocytes are for UV protection. And it is produced in the same way as with even lighter skinned people. And the function is the same even with them. So it is to produce the skin pigment, which would make me brown and somebody else lighter or even darker than me. So the role of the melanocytes and why I drew it as a little umbrella here is that it shields the cell, right? The skin cell. So it is the shield and the UV protection. And then you've got the Langerhans cells. So what they are is the defense system. So just like there are other systems in the body that, oh no, sorry, there are other systems in the body that are for the defense and immune defense. So these Langerhans cells are the ones that actually detect and fight infections. So you find them in the upper, and they are split between the epidermis, which is the top part of your skin, and then the dermis, which is the lower part of your skin. And then you also have these guys here, which are the fibroblasts. So these are responsible for making collagen and for healing, and also you have for hair as well. So if your body is not making enough collagen, you are not going to be able to heal very well. And also you have the sensory nerve cells. So what they do is if you touch something, it's either hot or it's painful. Those are that is the job. So you have the cells that work in the dermis and also the cells that work in the epidermis. So basically your skin is your wall, it's your alarm system, it's your immune system as well, and also your echo. And then, like I mentioned before, we are currently in the middle of climate change, and Africa is experiencing. You have UV radiation, which is not heat, that is causing the damage without actually sun, which is very dangerous because if a person is sunburned, then they are aware that, okay, I have a problem. But then if the damage is happening and there's no sunburn, you feel safe and you're not. So the South African reality is that we as South African people, we love our outdoors. I'm a Cape Townian. I'm always weekend, Saturday, Sunday, you will find me at the beach. And you will find me, if I'm not at the beach, at the park or something, but I'm outside. And also, there are people whose careers is outside construction crews, EPW workers, civil engineers, and some other people actually work outside every day. So, all year round, these people are at risk of high UV. And then also we have the false sense that, just because like I'm melanated and black skin don't crack. No, 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 it does. We have a false sense of security as African people, that we are safer because we are dark. No. And the problem is just because you don't feel the sun, you don't feel like the damaging effects of the UV are happening. Yet they are, right? So the key takeaway from today is please understand that even if you don't have a sunburn, even if you don't um, have any spots, it does not mean you are safe and you don't have to use SPF. Okay, so now that we understand that UV is there, because that's how it works, we now need to understand how skin cancer starts. Okay, so you have the sun, you have the UV, and then when the UV rays, sorry, hits the sun, sorry, when the UV rays hits your skin, right? There's a lot of damage because what happens is that the UV rays then penetrates your skin cells, and this is not a once-off thing. It is a repeated and accumulated process over time. And then what happens is that the damaged DNA cannot be able to now try and work nicely. So the cells are trying to repair the damage, but because of repeated exposure, it is overwhelmed, and then mutations they slowly start to build. And this is silently and this is quietly, and you are unaware. So skin cancer doesn't start suddenly, it really happens over time. And then you have the mutation, and then the mutation is building, and then the repair, the skin repair is happening, and then that is how it is then going on, and then that is when now the skin is at risk of the cancer developing. Okay, so what are the types of cancers that are there? Okay, so you have three types, and the one type, the melanoma, that is the most dangerous one. So you have the basal cell one, and then you have the squamous cell one. But again, the other thing is that because Caucasian people are lighter, they might have sunspots, they might have stuff on their skin that is visible, that then actually then shows that there is a problem. But then people with my skin tone, they feel like, oh, no, 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 I'm okay because nothing is showing. No, it doesn't mean that we don't suffer from skin cancer. And it doesn't mean that because melanin is in our DNA, we are safe from the sun. No, 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 there isn't. So also there is an ABCD rule on how to check your skin, right? For detection of a melanoma, which is the most dangerous one. One is the asymmetry. If you have just a mole and it looks round, it's okay. Or if it looks even on all sides, but if it looks lopsided on any other side, then there's a problem. Also, the borders. If the borders on the outer edge of the skin are uneven, there's a problem. Again, see color. If the color is looking darker and it has multiple colors in one mole, there's a problem. Again, the diameter. If the diameter of the spot or the mole is beyond 6 millimeters, it's a problem. E from the ABCDE of you checking your skin is evolving. If it is evolving and changing into something else, then there is a warning. So, again, how do you check, right? If you have new and changing spots, that's a problem. If you have sores that don't heal, okay, there are also underlying factors like, for example, people with diabetes and some people with immune diseases um, do not heal faster, or they don't seem to heal at a good rate. But if you have none of those, don't have diabetes, don't have an autoimmune disease, you're okay. But then you have a sore that is new and is changing, and you have a sore that is not healing, and you have dark, even dark streaks under your nails, that is a problem. Again, even your palms, even inside your mouth. And also, if also the soles of your feet are having spots, that's a problem. If it changes, if it bleeds, if it doesn't heal, then you need to be able to check it, right? Then, how do you prevent, right? Okay, now I've talked about the bad stuff. Let's start talking about the good stuff. One, you can prevent um, you and your family getting skin cancer by using a broad spectrum sunscreen. You can start from SPF 30 and even SPF 50. Again, I always joke and I say anything after 50, it's a lie. There's nothing. Don't buy that. So 50 and 30. Again, if you are, let's say you get to the beach around 3 and you you put it on, you go, you sweat, you swim, you use a towel, you chill, that SPF is gone. So you need to understand that you must always reapply SPF as many times as you have wiped it. If you are sweating, reapply. If you are swimming, reapply. If you have been in the sun for more than 2 hours, please reapply again. The other thing that you can do, you can wear hats that can cover your face, and then also you can wear protective clothing that can come up to your wrists and up to your ankles so that you can be protected. Again, please seek shade. If you're going to the beach, please, if you're a beach girl like me and you like going there, please invest in a big umbrella that can be used at any time and you can just chill. And also avoid going into the sun at peak times when the sun is like sunny. Okay, so here's the thing. As a person, you do not only exist on your own. You go to work and you are part of the community. So how do you prevent other people from suffering? Okay, now you've attended the course, sorry, the masterclass, and you now understand a bit. So you now need to be a representative of SunSmart prevention. How? If you see someone or you are close to somebody and you see them being at risk, you can also share the information with them so that in your workplace you can be like, maybe we should put on sunscreen before we go. In your community, if you're having community gatherings, then you can also share the information as well. Now, the other thing with information, it is not always readily available at all. It is always, sometimes um, people suffer because they lack knowledge. It is not because they are irresponsible in their choices when it comes to skincare. They sometimes don't know. So in our company, we decided 3 years ago that we would invest in making SkinWise. So what SkinWise does is it is a skin directory that explains all the skin's conditions, diseases, whether it's fungal, it's viral or bacterial diseases, whether also it's genetic conditions, or whether it's DNA, or whether it's conditions that are primarily common um, in African descendants. So what we did is that we started that, and then in the past 3 years, we started being very intentional about taking pictures of black skin. The reason why we did that is so that we can have a digital platform that is for African people and that explains so much for them. For example, we have an app that is called SkinWise that works with the Skin Direct. How does that work? A person can take a picture of the affected area, they fill in a form, and then it explains to them either via WhatsApp or on email what the skin condition is. Why we did a lot of people in Africa do not have medical aid, do not have access to dermatologists, do not have access to the information. And so, again, what we then decided to do at SkinWise is also explain the conditions in people's languages. So, even in the form, it will ask you which language do you want this explained in. So, that is our bit in trying to explain. And the other thing that we did is I have 2 patents on making biopolymers. So biopolymers are actives that help to repair the skin. So what we realized is that even though um, people are sick and sometimes they have underlying conditions, what needs to be done is the skin barrier strength still needs to be take example of my hand. As it is, it does not have anything on it. But if there is a tear or if there is a skin condition, then what needs to happen? It needs to heal. But how does it? We heal the skin by making biopolymers. For example, and films that heal the skin. So our innovation is in number one, skin protection, and also in digital health. So that brings me to my next slide. So digital health is very important. And I'm going to hand over to Dr. Rowen so that he can explain more on digital health.
Thank you, Namashubi, for that bit. I'm just going to share my screen. Namashubi, just stop sharing for me, please, and I'll start sharing my screen, right?
Yes.
Perfect. Okay. Just let me know if you can see it. Perfect. Thank you so much. So thank you for that. So what I'm going to do now is bridge this masterclass to education. And on this slide in particular, we're really setting the context for this here. I'm just going to start the video. Perfect. So what we're doing over here now is we're going to set the context for how we bridge this masterclass to education in particular. So today we've spoken about SunSmart skin cancer awareness, not just as a medical issue, but as a workplace issue, a community issue, an economic issue as well, but also a leadership issue. And we're trying to see how we actually go against this, or how can we make this better. In South Africa, for example, high youth exposure, as Ramashobi mentioned, outdoor work and unequal access to healthcare all intersect. And that makes prevention and early detection even more critical. What often gets missed is that prevention, early detection, and patient education as well, and masterclasses such as this, also system responses don't just happen by themselves. They require strong health leadership, ethical and effective operations, even an ethical governance and a data-driven decision-making system. So this is where education becomes the bridge between awareness and real sustainable impact as well. So the slide introduces one of the key ways that we build that at Regenesys. Our postgraduate diploma in business management with health-focused electives is designed for professionals who want to work at the intersection of business, leadership, and healthcare as well. And these electives are practical, applied, and highly relevant to real challenges that want to also relevant to the workplace wellness and public health initiatives such as SunSmart as well. If we're looking at the first elective in the postgraduate diploma in business management, this elective speaks directly to why awareness alone is not enough. Skin cancer prevention programs like SunSmart don't just succeed on awareness alone. They succeed when leaders understand how healthcare systems actually work. And this module teaches individuals how health programs are designed, how are they funded, how are they governed, but how can they also be scaled? It helps professionals also understand public versus private healthcare systems and the role of NGOs. And also, how does the NHI fit into the broader health landscape as well? And this is something which we have to keep in mind and be cognizant of, especially with the implementation of it soon approaching as well. Most importantly, it builds leadership skills that align health strategy and real world outcomes as well. So, why healthcare management matters for SunSmart? And here's why this matters in practice. SunSmart campaigns must align policy, regulation, and also health and national priorities to be effective and sustainable, right? And ethical leadership is critical when dealing with screening, with access to care, equity, and patient rights. Graduates of this elective would be equipped to lead corporate wellness strategies. They'd be able to manage your NGO programs, but also drive initiatives within the organization. So basically, this module teaches you how to turn health awareness into a system-level impact, which is important to bridge that gap between theory and practicality as well. If you're looking at the second elective, Health Services Operations and Quality Management, the slide focuses on what happens after awareness. We often say that awareness is step one only, but step two is what happens when people actually enter the health system. And this elective focuses on that. It focuses on the patient flow, the service delivery aspects to it, but also operational efficiency. And it looks deeply into quality standards, the safety, compliance, risk management, as well as how data, your key performance indices, and dashboards are used to improve quality care ultimately and improve the well-being of individuals in South Africa. But why does operations and quality matter? Again, for skin cancer specifically, because we're talking about this now, screening and treatment require efficient referral systems and timely action. If there are delays or overcrowdings or poorly designed processes, this can mean misdiagnosis, and those delays cost lives. So quality management ensures that care is safe, ethical, and patient-centered as well. So this module is really important. It's really exciting actually, because it equips our leaders to make sure that once awareness drives people to seek help, the system is ready to respond to that effectively thereafter. If we're looking at the next program, and this is our MBA, the Masters in Business Administration, we have an elective, a healthcare elective on strategic health systems and leadership. And this slide shifts us to a system level and leadership perspective. At a national and organizational level, skin cancer awareness is a systems challenge. So it involves policy, funding, leadership, equity, but also long-term sustainability. And this MBA elective is designed for senior leaders and executives who want to now influence health systems at a scale, right? But what does this MBA elective develop, right? And what we try to encompass is the development of advanced health leadership and governance capability, with a strong focus again on the NHI readiness and system reforms as well. So it's here to build skills in ethical leadership, in data-driven strategy, and system performance as well. But prevention reduces long-term healthcare costs, and strategic leaders are the ones who influence policies, partnerships, and resource allocation. So this module in particular prepares our leaders in healthcare, not just to manage health initiatives, but to shape the future of health systems in South Africa. If I move on to our programs with immediate practical impact, not everyone wants or needs a full qualification right now. And that's why our short learning programs are so important. These programs are designed for that immediate practical impact, and they allow professionals to upskill quickly and apply what they learn straight away into their workplaces, into their communities as well. And just to give you an idea of some of the programs that we offer, each of these programs links directly back to prevention, early intervention ultimately. We have things like digital health and data literacy, which would be able to help track skin cancer and trend screening uptakes over time. There's a short learning program on infection and control, which ensures that safe environments for screening and treatment are there. If we're looking at health system strengthening support, health alignment with the national priorities such as the NHI, telehealth and AI, something big, something relevant, which expand access to dermatology services, especially in rural areas now, such as the application which Nomahlubi mentioned and spoke about, which is brilliant. And we also have one on mental health first aid, which supports patients coping with diagnosis, anxiety, or long-term treatment as well. So ultimately, and together, these programs strengthen the healthcare ecosystem around prevention. So as we close, I want to leave you with this here. SunSmart awareness is the starting point, but education is how we sustain it. How do we scale it, and how do we make it last? And understanding health systems is no longer optional. Whether you're a business leader, a healthcare professional, a policymaker, or an entrepreneur, each one has a role to play in shaping better health outcomes. And at the School of Health Sciences, our commitment to this is simple. to empower leaders to move from awareness to action and from action to measurable system-wide impact. So now, Mahlumi, I'm going to hand over to you to explain a little bit more about SkinWise and if there are any questions and that you would like to take as well.
Thank you very much. Let me share again, but just I'll also try and recap. So the reason why we started SkinWise was because a long time ago I used to work for a multinational company that used to make nice skincare, but not everyone was able to afford, right? And I was doing my master's in polymer science, and I decided that I'm not going to go the academic route. I actually want to patent this and turn it into a business. But the business that we do is we aren't really into um, making expensive solutions. We want to make solutions that make everyone healthy while still making a profit. So I'm going to try and make this session as interactive as possible. So, um, firstly, I addressed the myth on black skin and how um, it does not get affected. So I would like to open this to the floor and ask, do you guys know of any myths that still exist in your community when it comes to skincare, skin repair, and also skin cancer? And the follow up question would be prevention. How, now that you've attended the session, how does prevention look like in your daily life? So I'll start with me. I I'm guilty of this as well. I apply sunscreen probably twice a day, which is not right because when I'm outside, I sweat, I probably go for a sweat dip and then I come back and then I apply. And then I sit the rest of the day in the sun, not doing anything. Sometimes I even nap in the sun, and that is putting my skin at risk. And most of the time, I'm like, I will be okay, which is not right because what you want with your skin is number one, you do not want to be a patient. The reason why you don't want to be a patient is that recovery from cancer is hard. It is hard on your emotions, your mental well being, your family, and it is also hard on your work schedule. It is also hard on your immune system as well, because depending on when you go to the doctor, then that is when you will have to be starting the treatment. So, does anyone have a question, a comment? I'm going to open it up to you guys. You can raise your hand and unmute, and then we can get started on that. Then I'll carry on and I'll explain about SkinWise and what we do and how you can also educate yourself on the various skin conditions, not only just cancer, but also there are a lot of genetic diseases, and also there are a lot of conditions that people suffer from, and it might be chronic and they are not even aware. So I'll open it up to you guys. Does anyone have a question?
No, Mahlumi, maybe I can go first. And my question
Yes.
is, directly linked to SkinWise, though. It's a brilliant app, and I think it's really useful in creating access to healthcare. To everyone, irrespective of your geographic location, and part of our goal should be to democratize healthcare as well. Just where can we find this application? Can we just download it from App Store or Google Play?
No, it's actually on the website. This website, it's on. Wait, let me move the screen. It's on a. It's on skinwise.co.za / your AI powered skin assistant. The reason why we decided not to make it into an app was because not everyone has money to download, and also not everyone has space to download. And this is not an app that a person uses every day. It is one that they need from time to time when they're experiencing something. And the only country that skin-wise is going to be zero rated in is Ghana, because MTN Ghana is making SkinWise available to everyone without them needing to go onto the internet. Anyone that is a subscriber on the MTN site can then use it. The other countries that SkinWise is in is 5 other countries. It's available here in South Africa, Ghana, Kenya, Tanzania, and also in Nigeria. And this week we are onboarding and training SkinWise advisors. Those are people that we take through the dermatology courses, so they learn the skin pathology, the skin conditions, the diseases, and how to interact with people. And the reason why it's important to be in other countries is because healthcare in Africa is hard. And what I like about Regenesys is that you guys are intentional about being available in many countries because a person can study online. And the only way healthcare will actually be better is through education. And it is through institutions like your own that are helping people to be able to understand. Let me go back into this slide, for example, to for them to be able to understand, for example, this telehealth and AI in practice in Africa is beyond important. Let me explain why. If people are in rural settings, which is more than half the geographical um, covering in most African countries, you will find there's metropolitan where people are able to access healthcare. And then the majority of the people are not able to access healthcare. But then how do you service the rest of the people that are not able to? How? It is by using AI ethically, like you said, responsibly, like you said, in line with government policies. For example, here in South Africa, you are even preparing healthcare professionals to be able to work within the NHI. And then also telehealth, right? And this is not only proven when COVID was there, it was also proven after COVID, because this was the only time where buying things online, getting medication online, talking to doctors online. So it had to take a terrible and an unfortunate pandemic for people to be able to understand the importance of telehealth and being able to service far flung areas. For example, I live in Cape Town now, but my home province is the Eastern Cape. And in the Eastern Cape, we are unfortunately very notorious about having a failing healthcare system. And when we say failing healthcare system, I think we're talking stats, but when we have to actually think, about the people that have lost mothers, fathers, partners, children because of this, then it brings the point home that it's only through education and by also being intentional about what it is that you're doing. Also, healthcare entrepreneurship is steadily growing in Africa because there are a lot of people that are understanding that um, we can't blame the system, we can't blame government. We can be able to go to school, learn a course that is in line with how you want to service your community. And through servicing the community, you can be able to do a lot of things. For example, you can be able to assist in infection control, in digital literacy, like we do in Skinwise. But I hope I've answered your question. I think I went a bit overboard.
No, that was
Um,
that was perfect. Thank you. I think it's really important aspects which you mentioned, and also which you touched on, which is highly relevant and important for us as higher education institutes to get involved in and try to, as I said, democratize healthcare for everyone. One more question from my side, Mamlubi. Are there any particular ingredients do you think we should look out for in our sunscreens or with those SPF, that you mentioned as well, um, just so that we are in a line or aligned with our skincare and what's best for us as well.
yes. Um, there are several sites that exist, right, to decode ingredients, to actually, how do I say this? Okay, so when a person buys a product, they hardly go to the back of the of the package and then actually see the ingredients. The ingredients by law are always there, and they're there so that people can be able to understand, am I allergic to this or not? But some people unfortunately do not understand that they have allergies because they've never been able to um, one, understand fully that now I have an allergy. So um, they don't know. So they don't look. And sometimes, even if they have an allergy, they don't know that this is an allergy. They think, it's a rash, until it lands them in hospital. So the one site that I would really recommend, there's two actually. There's one, it's called Paula's Choice. It's www.paulaschoice.com. So what it does is it explains the ingredients, and then it explains, is this a good ingredient, it's not a good ingredient, is it carcinogenic, is it causing irritation, all of that, and it rates them in a scale. And then there's another one, which is called Inky Decoder. So Inky is the name, right, of the ingredient. It is the universal name that the ingredient is listed as. So it's called Inky Decoder. It's spelled INCI Decoder. So there, you can actually write down the product that you want to buy or that you bought, and then it will explain what is there. Or you can write the ingredient that you feel uncomfortable about or you don't understand. Then you can be able to put that on, because um, there's a lot of um, ingredients that some suppliers put in as fillers so that their batch is a bit cheaper, but the long term effect on the skin of the consumer is not great. So I recommend Paula's Choice. or inky decoder, then you can be able to know what you are buying. And it's easy because you can be in the aisle or online, and then you can just copy and paste the name, and then you can put it, or you can just type in the name, then you can put it. Then it will explain, number one, its function. Number two, the ratio that it is inserted in. Is it now following the FDA or is it following EU regulations? And then you can be able to see, okay, this is good or not good for me. Then you can make an informed choice, because what you're asking is a very important question, and consumers are not very um, worried about what they put on until they have a reaction. And then that means they are reactive. But we need to be proactive consumers. You need to understand, what am I putting on my skin? How is this done? And then you can be able to buy it. I hope I've
Perfect.
answered your question.
Yes, you did, and that's very useful. I think it's great that we have these types of tools at our disposal to actually make it much easier to navigate in these different sections which we aren't necessarily comfortable with. So thank you so much for that as well. I'm going to open up the floor if there's any questions from any of our attendees as well.
I think our attendees are shy.
Okay, no, great. I think that's fine. So that brings us to the end of our masterclass, Nomhlubi. Thank you so much from my side for such an insightful and engaging session. Your presentation really highlighted how something as simple as sun awareness can have a profound impact on preventing skin cancer and also saving lives. I think today's masterclass reminded us that SunSmart behavior isn't just a seasonal concern, but a daily responsibility for ourselves, our families, and our communities as well. And the practical tips and clear guidance which you shared make it much easier for us to take action and to be more intentional about protecting our skin. I think that's what we really, really appreciate. So, on behalf of everyone here, for our viewers, thank you for sharing your time, your expertise, your passion with us today. We truly appreciate it. And to everyone who joined, thank you for your active participation. We hope that you leave today feeling more informed, empowered, and motivated to practice and promote sun safe habits. Have a wonderful rest of your day, and please remember that protecting your skin today protects your skin for tomorrow. Thank you, Nomahlubi, and take care.
Okay. Thank you.